Good morning for many of you and good afternoon for others. I'm very excited to have you join this highly anticipated session, What Has Changed Since COVID-19? Before we get started, wanted to share a little bit about me. I'm Director of Client Services out in the Western region. I'm fortunate to work among top cybersecurity experts that we have joining us today. On the right hand of your screen, for those of you who are just now joining us for the first time, you'll see an area where you can ask questions. We'll reserve those answers for the Q&A session at the end. Highly encourage you to message us if you have any troubleshooting or questions that you need to ask the moderator, and also encourage you to fill out the poll question at the end so we can get your survey responses. Now, joining us today are two of my favorite top cybersecurity experts, mostly for their passion within the industry to inspire others by sharing their wealth of knowledge and experience. Without further ado, I want to introduce you to Randall Frietzsche from Denver Health and Dave Bailey, a colleague of mine from CynergisTek. Thanks, guys.
Hey, Randall, go ahead. Why don't you just say a few words and then I'll start the presentation.
Okay. I am Randall Frietzsche. I go by Fritz. I'm the enterprise CISO for Denver Health here in beautiful Colorado. I have also been given the ISSA Distinguished Fellow designation, and also I teach cybersecurity for Harvard and for Regis universities. And I'm glad to be here with Dave today.
And good morning and good afternoon. My name is Dave Bailey. I'm the Director of Security Services for CTech. Just a real quick background. I've been with the company about 4.5 years, and over that time, I've really had the pleasure of working with a great group of professionals conducting the risk assessment business, and have worked with many of you here in the audience today, and glad that you could all be here to participate. Prior to my time at CTech, I was a director of technology and HIPAA security officer at a 2-hospital health system, and really cut my teeth in cyber in the Air Force, and had the opportunity to really see how the government was starting the whole cybersecurity experience back then. But what I want to do today, and what the purpose of today is really to bring you two perspectives. I want to talk a little bit about the changes and challenges since COVID, and really from a CTech perspective. What are we seeing across our client base, and what our perspective is on the industry, and then I'm going to have an opportunity here to turn it over to Randall and talk a little bit about how all of that really worked with Denver Health, so he can talk about the silver linings and lessons learned, and then take any questions that you may have. All right, with that said, shifting baseline, I think is most of if you really want to know if the bad guy's doing something to you, you really want to know if you have a good program, you have to set a baseline. So, what's the baseline? What are things that we know? What we know is that the way business was conducted in January of 2020 looks nothing like the way it's conducted now. We do know the threat and the targeting of this industry is increased. There's just too much data out there to prove otherwise. What we think we know that the need for a remote workforce is not going away. And we also know, just by what has occurred, that telehealth increase will continue past COVID. That's what we think we know. What we need to know, and I know that many of you may have these questions, how has all this impacted our ability to safeguard our people, our data, and our business? I think knowing that the baseline has changed, that it is going to be a challenge as we move forward, and we're all going to have to rethink not only the way that we conduct our business, the way that we deliver our IT service, and the way we run security. And we as CynergisTek also know we have to change the way we assess, and we have to take into account all of the, the current threat, the current situation, the current environmental factors, because I know that everyone's baseline has changed. So, from that, we all have to adapt. Just here's some evidence of that, really kind of stating the obvious. In February of 2020, less than 1% of Medicare primary care visits were provided through telehealth. This is data directly from HHS. And in April, that number went to 43.5% of all primary care visits were done through telehealth, and that's all Medicare beneficiaries. Gartner just recently conducted a survey and released it in the end of June. And interesting statistic, 48% of all employees will likely work remotely. One of the things I want to comment on this is, if you look at the way that, most organizations conduct their business, there was just jobs prior to COVID that you just never envisioned that you would work remotely. There were, many departments, many functions that it was just an expectation that you showed up at the hospital, at the office, and you would perform that work on site. Well, I think today, I think that Band-Aid's been ripped off, and if there was just a necessity to have to work, from home, and I think it is going to be interesting to see, how that all plays out whenever we reach whatever our new normal is. There was a security officer pandemic impact survey that was conducted, and I found these to be interesting statistics. 61% of the executives said they were concerned about attacks against remote employees, and 73% said that COVID will change the way they evaluate business risk. I think this is a really tremendous, impactful statement. Most of us know we are in the risk business. We have to be able to evaluate and identify cybersecurity risks. We have to be able to put our organizations in the best possible situation to be able to ensure that they can, protect data, protect their patients. And I think knowing, we have to look at what has occurred over this year. We have to learn from it. We have to adapt in the way that we assess, in the way that we implement security controls, and the way that we validate security controls to really make sure that we're providing the appropriate safeguards. I looked at ransomware statistics that were provided by NCSoft Labs. They collect and report on about a quarter of all of the global ransomware that has occurred. And in Q1 of 2020, which was about 125,000 positive and reported incidents of ransomware, a couple things I want to point out here, which really has a direct impact on healthcare. Now, while this is ransomware throughout the world, it's just whatever ransomware is, however it's impacted. Well over 25% happened in India, 13% in Indonesia. The United States was at 10% of all those cases. What was interesting about that, and something that I know directly relates to healthcare, is that one of the driving factors out of that ransomware is that they still are so many systems that are not operating on known and secure and current operating systems. So you had 39% of the computers in India that weren't running Windows 10, that were running some shape or form of an operating system that is end of life, unsupported. So, why is that important to healthcare? Well, the statistics out of that data was 77% of computers are running Windows 10. And what I will say to healthcare, as many of you know, one of the challenges in healthcare is that we have to deal with, this industry has to deal with legacy and unsupported operating systems. The pace of the technology that has to be deployed in order to care for a patient is not keeping up with the need, to be able to, consistently update, refresh, and secure. What I also found interesting out of the threat statements that came out of their report over the first quarter was, and I really want to highlight, things that Caleb mentioned in his opening presentation about, really what are the bad guys doing, and why is there just this increased need for ransomware? Well, right now, it's not just about, leaking data. It's about weaponizing it. And what they're seeing is more ransomware groups. They're doubling down in their blackmailing efforts. They're using the data against business partners, and they're using it to, certainly publicize, victims. And I think, I've always said, why do things happen? They wouldn't happen if it wasn't important or somebody wasn't gaining from it. So I think more and more the value of the data that healthcare has to operate and maintain is so valuable, and this threat's not going away. So, all right, from a CTech perspective, I just wanted to highlight a few areas. So, we're well into the year now. Not only did you as an industry that cares for patients have to really just blow up 2020 and adapt and adjust. We also had to do the same thing from our perspective, and we had a chance to see and talk to and work with many clients, and I really want to bring that perspective to you. One of the things that really was apparent was the supply chain challenges that existed, and I work personally with many clients on specific questions around, hey, we had a supply chain. This is where it came from. We understood them. They were a partner of ours. Now you may not be able to, get that widget or get that necessity that you need. You have to switch suppliers. And now you have to conduct third-party risk assessment. And in most cases, some of that risk assessment really was, just check the box and move on, did not have the time to really assess risk the way you wanted to, knowing the state that the organization was in. Another interesting was I had a vendor call up and a client call up and say that a vendor that they needed to buy supply from, they just conducted a risk assess on it. They needed an answer quickly to tell leadership, and they just wanted our take. They said, "Hey, this is what we found out. What do you think?" And one of the telling things was that the website that was used that they were going to purchase the necessity from was literally just stood up that week, and it only had a 3-month certificate. So you decide if you wanted to buy from that particular service. So, these are types of the challenges that we certainly, see. I think all of the normal processes that folks have in place to assess risk, really blew up. I'm not going to hammer home on this is enough. I think we all know the rise in telehealth. If we were asked once, do we think that Zoom is secured to use? I think we were asked 100 times. But the bottom line is, you have to be able to understand, what the risks are to that commercial off the shelf telehealth use. And I think, for the most part, folks were thrust into using it. And I think we're going to have to, work hard as, security professionals and as partners in this security game to help you understand what those risks are now moving forward. User entitlement pressures. This one is a really interesting one where, you go from, I think this here from a baseline perspective is really key. You have a situation right now where, maybe you only had a quarter percent of your workforce that work remotely. Now, all of a sudden you have to provision, thousands, if not thousands of accounts and get folks, provisioned under that. And there's certainly entitlement pressures, for the most part, that's usually get it done and we'll figure it out later. And I think, part of knowing what you need to assess moving forward is certainly put emphasis on what entitlements that you give folks that, normally would show up to work, and now they're working from home. So what type of entitlement do they have? What do they have access to? And how does that change your risk profile? Some of the things that were touched on, I know this for a fact. I do 100% know this for a fact that I've probably looked at hundreds of incident response plans from all the assessments we do here at CTech. I don't know if I've seen one where there was an appendix on how this incident response plan adapts to a global pandemic. So obviously from that standpoint, understanding what the effectiveness is of that, can you respond? Do you believe you can respond, with your workforce, and how effective is your plan, knowing that the workforce is remote? And I think it is time and understanding as we move toward normal that everyone's incident response plans get pulled out and really adapt to this condition that the workforce just may not be available to perform functions, and how you respond to that, and also how you communicate as well. This one, the bottom one, I think is near and dear, in the sense that as a security professional and a former HIPAA security officer who certainly had responsibility for safeguarding data, you want to believe that what you have in place works. And knowing that the baseline is changing, do you really know what's occurred over the last 6 months? Are your controls working? So I think some of the things that we want to be able to work with you certainly is to help you, help you have that confidence, help you understand that the security controls that you do have in place are effective. Okay. Now, with that said, and finishing up my perspective from CTech, I now want to turn it over to Randall and offer him the opportunity to kind of tell the story of Denver Health. What happened, how they responded, what were some of the silver linings, what were some of the lessons learned. I've had the opportunity to work with Randall over the years, and I know he's got a very, very good understanding of risk, and I'm really curious, Randall. I'm going to put you on a spot at the end. I have a few questions to start out just in that risk game, and looking forward to hearing what you have to say. So with that said, let's hear from Randall and the perspective from Denver Health.
Thanks, Dave. So we were like everyone else. We were running along just fine. January, February. We always had telehealth on our radar as an important function that we needed to be able to do to help find better ways and different ways to treat patients. But we really never did much with it. And overnight, really in March, literally 3 days, we changed that strategy. We were seeing patients via telehealth platform who couldn't come in or didn't want to come in the hospital for appointments. And we also had scrambled to bring a lot of areas, a lot of units in the hospital, turn those into COVID units. And that was very difficult to do. And that had a lot of technical challenges as well, a lot of biomedical equipment moving around. And then with the COVID patients, there was the big concern about the lack of PPE. So telehealth really helped us to not only serve those patients who couldn't or didn't want to come in the hospital, but it also allowed us to treat COVID patients inside the hospital, minimizing exposure to the healthcare workers and minimizing the use of PPE by having telehealth inside the hospital. So we would have all-in-one units with our web platform, web meeting platform, and then the doctor would walk around or sit at his desk or her desk with a laptop or a tablet, and they would round on COVID patients from their office, and that decreased the exposure of the healthcare workers. It also allowed us to preserve PPE, so they didn't have to change out the PPE every time that they entered a room. So that was a great thing. Now we're seeing a large majority of visits happening still on telehealth, and we're allowing that to happen for our Medicare and Medicaid business, which is a vast majority of our business. And as Dave said in the beginning, you couldn't even bill for telehealth for Medicare and Medicaid. And now that's changed. So that was great to help us out financially and to make sure that we're better able to take care of our patients. Another big thing was obviously the remote access. We had probably maybe 100 people working remote full time, and within a week we had 2,200 people working remote. Thankfully, we had already built secure remote access platforms with multi-factor to serve both folks with Denver Health devices and folks without Denver Health devices using their personal computers through two different methods. The Denver Health laptops were VPNs, and both methods required multi-factor access. The only challenge we had there, two challenges. One was bumping up all of our licenses for the various ways, VPN licenses, multi-factor licenses, but also just approving folks to work remotely, because you have to apply, fill out a form, and your manager has to approve that so that you can work remote. And just getting all the paperwork done for 2,200 new remote users, that was a challenge that took a lot of time for us to get those in place. And we allowed folks to go ahead and do it because it was literally almost overnight. We allowed folks to do that, and we sort of backfilled the paperwork process on that and worked a lot of nights and weekends for that. So the remote access and the telehealth were two big things. We had about 200 brand new critical COVID projects come in within 1 week. We had a crisis team, a COVID crisis team, and we would get requests from that team multiple times a day for things that are very critical and have to be done right now. So immediately, everything on the IT project plan got put on hold, and we began scrambling to resolve all the new COVID crisis projects that were being submitted to us. And from an IT perspective, that certainly was a challenge. But from a security perspective, we had to support those IT projects. We had to, make sure that the things they were doing were being done securely, understanding that they were very critical and that we had to modify the way we do things to make sure that we were doing it as fast as we could without compromising the integrity of the process. And another big challenge was all the new sharing things that needed to happen for public health, CDC, all the ways that they wanted to share data now were sometimes very different from how they had in the past. It stood up quickly and maybe not done the way we normally do them. And so just being able to vet those on the fly without getting in the way of the business and getting in the way of the public health crisis that we were having and still are, just trying to keep track of all of that so that once everything passes, we could pull it back in again and turn off some of those things that may be more risky than we normally would allow. So that was another challenge. And then the last thing really is just the prevalence of all the new phishing and ransomware attacks that were coming up using COVID as a premise and trying to get folks to click on things so that they could, breach them, email compromise, or give them ransomware or something else. And my communication stepped up through the roof. I had a daily blurb. We had a COVID daily email that went out, and at the top of that email, I had a blurb in there that said, the risk of phishing has increased. I saw some numbers as high as 30,000%, and that everybody had to make sure that they were being very diligent and very aware and cautious when using external emails. And because not only is it always a problem if you got ransomware or business email compromise, But if that happened in the middle of COVID when we're trying to respond and take care of our community, that would really be a bad day for us. So we had to not only communicate that to make sure the users were aware of that constant and new threat, but the security team also had to continue to stand on the wall to protect the organization and keep an eye out for the threats that may be trying to get in or may get in. And we had to do that in concert with all the other things I just described. So definitely a challenging time. And I think what Dave said about the remote workforce, we really were finding that all the different modalities of employees and different types of departments and so forth, we did find out that they can be productive. Actually, in fact, they've shown in some areas they were more productive working remotely. The biggest challenge, I think, is for people who are not working remotely ever or rarely. They have a little bit of a technical challenge trying to get used to working from home. Firing up the VPN sometimes can be a challenge, especially integrated with multi-factor authentication. So just getting everybody up to speed technically around those technical things. But then also the environment of working from home, especially if you have kids that they can no longer go to school. They're physically present constantly, and dogs and neighbors and delivery men and all the things that are distractions for us trying to work from home. I think that's something that I've seen have some impact. And then really the fatigue, right? And on the Zoom meetings or WebEx meetings or whatever platform you're using, and including the virtual conferences like we're on today, I think there's a fatigue with that. I think we are finding that relationships can break down when we're not physically present with folks, and that the technology, even the WebEx technology where you can see each other, really it does not help as much as being in the room with folks. So I find that to be a challenge. For me, I work in legal, and then I also oversee the security team. So I have seen relationships start degrading simply because you're not in normal contact with folks, especially in person. You can't go to lunch with each other, go have coffee. And so I find that to be a challenge as well. Dave, you have any questions? I think you're on mute.
My apologies. I have a few questions and actually a few follow-ups, and let me do these questions first, and then I do have a couple follow-ups, based upon what you said. Right now on a scale of 1 to 10, if 10 was the most confident, what's your level of confidence in the state of your program? Do you have the same level of confidence from where you were prior, or are there things that that you need to plan and focus out based upon what has occurred?
That's a good question. And I would say that, as you know, we have a lot of support from the organization and have had for many years, and that has allowed us to build a very mature security program, a very holistic program, and a really strong team. If I did not have that, I would not feel confident at all with the changes that we've had. It would make me less confident. The fact that we have that already, that we do risk management really well and have continued to do that through the COVID situation, I feel really confident about. The thing that makes me, the two things that make me not as confident, one would be all the new sharing situations that we have and being able to keep track of those and vet those properly, and the speed at which we've had to move, and really the lack of ability to really keep a close eye on those the way we did before. The other thing is allowing over 2,000 people to go plug in our devices on their personal network at home. And the level of security at that point is out of our control. You know, we feel confident that when they're on our network, but when they're plugged into their home Wi-Fi and they fire up a VPN and ride the tunnel into Denver Health, what else is on their network that wouldn't normally be on the network if they were plugged in at work? And so that's one thing that makes me less confident, just because of the sheer volume of people who are doing that. But I still feel that with the proper controls, the you know, advanced threat intelligence and detection on the endpoints, along with the network threat intelligence that extends across the VPN tunnel, I feel we're probably still okay. I just wish we had more time to assess and really be able to dive deep into sort of that network threat analysis and make sure that we're not seeing anything weird coming across the tunnels for all of those users.
Yeah, and the next question I've got for you, I if you wouldn't mind maybe answering in two parts, because I'm, you know, obviously I know from you know, knowing your program for a few years now that you have a pretty structured approach at how you assess risk and manage that and determine it. Has that approach changed? Are you looking at risk, and maybe can you describe a little bit about, you know, what that assessment looks like?
Mm-hmm. So our assessment process has not changed. We inject risk stratification into the purchasing process. So whenever you submit for a contract to be signed, you have to fill out a risk stratification questionnaire, and that opens a ticket for our team. And then our team takes that. The risk stratification really is, you know, a few questions, just really high level. What kind of data are we sharing? How much of that data are we sharing? How many medical records, for instance? What's the situation of the sharing? Is it a web portal on the internet or a SaaS platform? And, you know, are they offshoring data? Are there any data breaches? So we asked just a few questions that are really risk stratifying questions that allow a security team to take that and then run with it and determine how big of a deal is this, and what processes do we need to do in that pre-contracting third-party risk assessment process to make sure that we get the big picture and are able to assess against control objectives and identify gaps, and then work a mitigation or even an exception if we need an exception. So that's all not changed. It's exactly the same. The difference is the speed at which things are coming to us, and the expectation of the organization to be able to go and snap their fingers and buy something because they really need it. It's a critical need, and just making sure that we can accept that challenge and make sure that we're doing it in a way that doesn't get in the way of the critical functions of the business. We are looking a little bit deeper into the organization's ability to defend against and recover from ransomware, because I believe that that's a lot bigger than it was a year ago, and I believe in a year it's going to be even worse than it is today. Just as you said, Dave, with, you know, it's so easy to do and it's so profitable, and folks are just not as well prepared for that. So that's really another aspect that we've added in when we assess a vendor, and it's really their ability to defend against or recover from ransomware.
Yeah, and the last part of that, I guess I would ask is are you able to have the ransomware discussion at your executive team, like with your executive team? Do they understand it? Do they really know what the impacts are, or do they look at you and say, "Hey, Fritz, you got it"? Or what does that look like at the executive level for Denver?
Well, that's changed. We used to think of ransomware as something that gets in your network and it encrypts the device, encrypts the data, and then you have to either have great backups or you have to pay the ransom. Now, today, I call it ransomware 2.0, and I think the executives are not quite yet caught up on this new ransomware 2.0, which exfiltrates your data and then holds it for ransom, and the risk there is not that you will lose access to your data forever. It is that they will take your data and share it publicly, which then could become a HIPAA breach, or could have financial implications or legal or reputational issues for you. So that's relatively new, and I have been talking about that with the executives and the board, and I think that they're really starting to come around to understand that ransomware is now a lot nastier than it used to be, and once they get the data, it's not a matter of recovering from it and moving on. It's now they have it, that's forever, right? So making sure that they understand that the controls we have today are still good for that, because we still have to defend it at the perimeter. We still have to defend it at the endpoint, and we have to train the user, because the control around that is the same. You don't want them to get in, and if they get in, you want to minimize the user's inclination to click. Those are the things that training will continue to help with, and certainly having the right controls and the effectiveness, and gauging the effectiveness of your controls through testing. That's really going to be the same thing. But the bad part then is if they do bypass all of that and they get the data and they exfiltrate it, then it's game over. At that point, you either have to pay them and trust that they're not going to divulge it, or you have to just accept the risk that they're going to divulge it and move on from that perspective. So I think that it's really important that everybody really understands technically how ransomware today, some ransomware today is different, and modify or at least review your controls against that new reality, and certainly make sure that your organization, your leadership is aware of the difference today than maybe a year ago.
Yeah, did they talk about the ones and zeros of it, or do you have to translate it into clinical speak?
They do not want to talk about the ones and zeros. It was so funny. The last board presentation that I spoke at, we went through the CynergisTek metrics that we get every year around how we rate against the average industry, and the controls that we have in place, and the great findings and the things we need to work on. And the chairman of the board actually said, "How are we this good? How do we get these great numbers?" And I said, "It's because of you, because of the board, the leadership support. If we didn't have that support, we would be right there in the middle of the average." And also allowing us to bring in CynergisTek, which really is a great measure, an external measure, to see how we're doing and what ways we can improve. And I just think that constant diligence around continuing to mature areas of your security program, areas that make sense. You certainly can't do every one of them, but to have a real strategy. And my strategy has always been risk management is the most important thing. Not only third party, but internal change management, risk assessments. Anytime you bring anything new into the organization, whether that's internal or a vendor, and anytime you make a change in the organization, you have to have that security oversight. So I think that that's really the most important thing, and we've focused on that. And then the other thing for me is that it's not if, but it's when they will get in. Everybody will be breached if you're not already, and just really not only being able to detect and prevent that at the network perimeter or any of the perimeters that you might have, but also to understand and have the ability to quickly detect when they do get in, and quickly detect when someone clicks on a link that they should not have, or goes out to a website that's been categorized as malicious, or have some sort of malware trying to propagate on your network. Be able to quickly see that, quickly deal with it, and at least on a first level mitigate that, so you minimize the impact of that. So for us, those two areas have been my key strategy focus for the last 3 years, and I think that helps to combat you know, as I said, ransomware 2.0, it's still the same controls, it's still the same training, it's still the same threat. It's just now that they're going to exfiltrate it instead of encrypt that in place.
Well, thanks, guys. I see a question came in from the audience. So wondering if either of you know whether or not Zoom has published their new security and improved security controls. They're going to be coming out with some security controls. And if not, has that been a concern for you, knowing that a lot of your remote workers and maybe their family members are on these different platforms?
So we made an intentional decision to not allow Zoom for telehealth. You can use Zoom for whatever you want except telehealth. And we did not have an enterprise agreement with Zoom. And we did not have a business associate agreement with them. We did not have their Zoom for healthcare. So even though the OCR said they were going to not enforce if you did telehealth through these methods without the proper agreements, we chose not to do that simply because it would be impossible to pull it back once we're done, and that would be having a secondary platform to provide telehealth that really wasn't supported by IT. So we chose not to do that. And one of the things was multi-factor, that Zoom did not have multi-factor access. And now I just heard that they just did come out with multi-factor, the ability to turn on multi-factor authentication onto Zoom. So it looks like I don't know about the publication of the new controls, but I can tell you that it made us not use them in the beginning, and but I do see them making great strides towards making their solution a lot more secure.
Yeah, how about you, Dave? But we got about another minute before we wrap up, and hopefully everybody heads to the networking session following this. But what have you heard about the new and improved security controls?
Yeah, I don't know of the publishing date, but I echo what Randall said is that there's a continuing effort to provide certainly a more secure platform. I would advise everyone that the decision to do that has to be whatever your risk tolerance is, and I understand that decisions may be made to use that influences and just need to be able to use that platform. Ultimately, from the security perspective, continue to evaluate what controls you can put in place, and really take it from a risk tolerance perspective. But I know if we were to advise and counsel you, I would not just look at the platform. I would look at the use. I would look at the multi-factor authentication piece of it, just beyond the technology, in order to make that that best risk-based decision.
That's great feedback. Thank you guys so much. I think this was very informative for our audience, and I would again highly encourage all the attendees to use the poll and give us a survey rating, and then also join us in the networking session. We have a 15-minute break before the next round of sessions get started. So thanks again for joining us.
Thank you.
Thank you very much.
Okay.
Good job.
Yeah, good job.
Are we are not live, or are we live? I don't know.
We are not.
Excellent. Excellent.
Who ended who pushed stop broadcast?
I don't know.
Okay. April, was that you?
No, I don't know how to push stop broadcast.
Oh, okay. That was really weird. Okay, because I didn't do it either. Okay, well, thanks everybody. That was awesome. Really appreciate it. We had about, I mean, last time I checked, I have to keep refreshing my screen, but we had about 50 people join the session.
Nice.
Yeah, so really
Very
great.
nice.
And, this will be recorded so we can send it out later. Oh, we're still live, it says.
Okay.
I'm going to hang up. Thank you, everyone,
Right.
even the audience.